Lie on your back with your legs bent over a chair or an object that allows you to get a 90-degree angle bend at your knees and your hips. Make sure that your ankles are not higher or lower than your knees at any point in this position. The object must allow you to relax your legs completely so you don't have to use any of your own muscles to keep your legs in one position. If you notice that your knees are falling out apart from each other, you can place a strap around them that will allow them to relax into the strap so they don't fall outward. Make sure that the strap doesn't have any kind of elasticity to it so that it presses in against your knees. You're going to place your arms out to your sides at a 45-degree angle from your body with your palms face up. Allow your lower back, hips, and shoulders to settle into the floor on their own. Balance and symmetry check. Pay attention to how your back, your hips, and your shoulders feel as they're lying against the floor. Do you notice that one side of your hips or other parts of your backs or shoulders is touching the ground or heavier into the ground more on one side than on the other? Take notes of any of these differences that are on one side of the body versus the other. They should settle down and become more symmetrical by the end of this position. You also have the ability to lie in this position for anywhere up to 10 to 15 minutes if you notice that you don't settle completely into the position. But it's not necessary to go longer than 10 or 15 minutes. Lie on your back with your knees bent and feet flat on the floor in front of you. Make sure the feet are parallel to each other and pointed straight ahead. Put your hands out to your sides, about 45-degree angle from your body with your palms face up. You're going to take the ankle of one leg and cross it over to the knee of the other leg. What you want to do from this point is press the knee of the leg that you crossed over away from you using the muscles on the outside of that hip. Be very careful when you're pressing this knee away from you to make sure that you do not allow your hips to swing out to the side. You must keep your hips and pelvis in a neutral position and prevent any movement there. You're going to hold for the recommended amount of time, keeping your upper body relaxed, then switch sides and repeat. Balance and symmetry check. Take notes on the differences of how it feels to cross one ankle over to the other knee because it might be different from one side to the other. Recognize the muscles that are working as you press one leg out versus the other. And also pay attention to any differences in how far that knee can move or your hip can open up from one side to the other. Over time, these asymmetries should even out. Lie on your back with your knees bent and your feet flat on the floor, hip width apart, parallel and pointed straight ahead. Place your arms out to your sides, in line with your shoulders and your palms face down. Cross the ankle of one leg over to the opposite knee. Once the ankle is on the knee, you're going to allow your hips to twist and fall towards the floor so that the knee and the bottom of the foot come in contact with the floor. If you can't get all the way to the floor, you can place something similar to a block or a pillow that will raise the floor up a little higher until your feet can rest on that. Keep your palms flat against the floor, and as you're rotating one direction, you're going to look in the opposite direction. Once your legs have hit the ground or the supported surface, you're going to press the knee outward away from you using the muscles on the outside of that hip. Hold this position. Make sure that you're breathing deeply through your stomach as you're holding this position. As you take a deep breath in, allow your stomach and your sides to expand. When you breathe out, let your stomach and your sides contract inward. Once you've held for the recommended amount of time, you're going to come out of this position in the exact same manner that you went into this position by twisting the hips back up. Then, place your feet back on the floor. Make sure that you have reset yourself and your feet are hip width apart again before you cross the opposite ankle over and do the other side. Balance and symmetry check. Do you notice a difference with how far one side goes compared to the other? Do you notice a difference in the muscles that are working in one leg versus the other when you're doing the actual pressing out of the knee? You might feel torque or tension in other parts of your body, such as your back, as you're going through the rotation. All these things are asymmetries and should even out over time. Lie on your back with your knees bent and your feet flat on the floor, parallel and pointed straight ahead. Your arms should be placed out to the side at a 45-degree angle from your body with your palms face up. Using the muscles in your hips, you're going to roll your pelvis backwards to flatten your lower back on the floor, and then tip your pelvis forward to create an arch in your lower back. You're going to move between these 2 points, attempting just to tilt the pelvis back and forward. As you tip the pelvis forward to create an arch in your back, use the muscles in the front of your hips and your back to create that arch. As you're tucking the pelvis underneath, flattening the back to the floor, use the muscles of your glutes and your abdominals. As you're tucking the pelvis, try to be very light on the feet and don't push your feet into the ground. Do this controlled and slow, trying to get as much range of motion as you can without activating or using any of the rest of the body. Balance and symmetry check. Do you feel muscles working on one side that are not working on the other? Do you have any kind of twinges or pains or discomfort in one part of your back or one part of your body that's not on the other side? As your pelvis learns how to create this movement and your body becomes more balanced, this should become more symmetrical with this movement and the pain should reduce. Find 2 blocks or thick pillows that are somewhere around 6 inches. Place a pillow or a block on either side of your body. You're going to lie down on your stomach with your forehead resting on the floor and bring your arms up and place them on the blocks or the pillows on either side of you. Your elbows should be straight out from your shoulders, and you should have the entire arm from the elbow all the way to the hand supported up on the block or the pillow. You should now be at 90-degree angles at the shoulders and the elbows. Allow your toes to touch each other and then let your heels fall out to the sides to make a pigeon-toed position. From this point, completely relax the body. Balance and symmetry check. Do you notice a difference in how comfortable it feels for one shoulder to be on the block than the other? Pay attention to the difference between what's touching the floor from the chest, the hips, as well as the legs. You might notice that some parts of the body are heavier into the floor than others. Of course, these are all asymmetry in the body, and it should change over time. Lie on your back with your feet flat on a wall, hip width apart and parallel to each other. Your hips and buttocks should be anywhere from 6 to 12 inches from the wall, depending on how close you can get where you still have your tailbone and pelvis able to relax flat on the floor without feeling like it wants to lift up. Place a block in between your knees that is about 4 to 6 inches in diameter. The block needs to be firm so that if you were to press against it, it doesn't have the ability to squish in. Hold the block for the duration of this position. Allow your arms to be out to your sides at a 45-degree angle with your palms face up. Balance and symmetry check. Pay attention to your hips against the floor. Do you feel like one hip is higher or in a different position than the other, or are they both flat on the ground? How about the different areas of your back or up into your shoulders? Pay attention to the difference in the muscles that are working in one leg versus the other leg. Take notes of all the different asymmetries that you can find and recognize that these should change over time. Place your back against a wall and keep your feet and knees about 6 inches apart. From here, you're going to walk away from the wall until you can allow yourself to slide down and put yourself in a seated position where you are about just over a 90-degree angle at the hips as well as the knees. The goal here is to have your mid-back, lower back, and hips completely flush against the wall. It's almost as though you're going to have a small slouch in your back and your posture in order to make this happen. Your head and shoulders will slightly come off the wall. Keep all of the pressure in your heels, relax your stomach, Put your palms face up on your lap and make sure that you do not use your upper body or shoulders at any point in this position. Keeping the pressure in your heels, you're going to hold this for the recommended amount of time. If you feel like a lot of the work is going into your knees, you can come up slightly until you don't feel the work in your knees anymore. You should feel the work in the upper thigh muscles, the quadriceps. Balance and symmetry check. Do you feel like both legs are working evenly, or do you feel like one leg is pushing into the ground or the wall more than the other? Take note in how even it feels where your back and hips are up against the wall. You might feel like it's not symmetrical from left to right, like certain parts of your back or your hips are touching the wall more than other parts. One thing that you can do if this is happening is to place a yoga block or some type of firm pillow between your knees where you're not necessarily going to squeeze it, but allow your knees to press into it, just enough to hold it, and see if that makes things even out. Over time, it should even out as things become more symmetrical.